Coastal Hospice. Welcome to our Caregiver Academy. We are excited that you are joining us today. Before we begin, allow me to go over a few housekeeping items. You may see myself or my colleagues Alejandra and Joy pop up in the chat box to address or help with any technical issues. I want to thank you in advance for your patience should we have any. I'll also discuss the program evaluation at the end of this webinar. Please use the chat feature to ask questions and communicate throughout the webinar. Further instructions are located in the chat box. I have the honor of moderating this webinar today and have invited 4 experts to explain the different types and levels of care offered by home health care, in-home private care, and hospice care. Deborah Stevens is a community liaison for Peninsula Home Care. Debbie joined Peninsula Home Care in 2007 and serves Wicomico, Somerset, and Worcester County. She has worked in the healthcare field for over 25 years and enjoys the relationship she has built with the hospitals, rehab facilities, and physicians' offices. Thank you, Debbie. Christina Wingate Spence is the Regional Director of Marketing and Community Outreach for Bright Star Care of Anne Arundel County, Easton, and Salisbury, Maryland. The past 18 years of her career has been spent in the healthcare sales, strategy, marketing, and communications, having worked for Genesis Healthcare and Heartfield's Assisted Living in Easton. In her role, Christina oversees Bright Star's marketing and community outreach and educational initiatives on the Eastern Shore and Anne Arundel County. She has been a certified dementia practitioner since 2019. Thank you, Christina. Abby Husfeld is a client consultant and outreach manager at Bright Star. She joined the Bright Star team in October 2019 after more than 11 years as a director of admissions and marketing, first with Berlin Nursing and Rehabilitation Center, and most recently with Salisbury Nursing and Rehabilitation Center. As client consultant and outreach manager, she spends time providing community outreach and participating in Bright Star's various community education initiatives. In this vital role, Abby is often the first impression that one has of Bright Star Care, as she also manages the intake process for all new referrals and prospective clients and their families for multiple Bright Star locations. Thank you, Abby, for being here. And Holly Murray is our team manager at Coastal Hospice. She was born and raised on the Eastern Shore of Maryland, attended Warwick Community College, and received her ADN in nursing and became a registered nurse in 2009, going on to work at Tidal Health for 2 years. She's been with Coastal Hospice for 10 years, received her certificate, certified hospice and palliative nurse certification in 2018, and her BSN in nursing in 2021 from University of Phoenix. In 2020, Holly was recognized as Coastal Style Magazine's Nurse of the Year. Thank you, Holly, for being here. And thank you again to all of our panelists. I'm excited to hear more about the ins and outs of home health care. Let's start there. Debbie, will you tell us what we need to know?
So hello, welcome everybody. Peninsula Home Care, we're neighbors helping neighbors. We provide a skilled medical services in the comfort of your home, usually after an illness or injury. The goal is to help you get better, regain your independence, and maintain your current condition or just slow down the decline. We require a doctor's referral, and our services are short-term, they're intermittent, and they include nursing, physical therapy, occupational, speech therapy, medical social worker, and a home health aide. A patient is eligible to receive home health care services when they are considered having a taxing effort to get out and about. Medicare covers home health services 100% if qualified.
That's great. Do you take any other insurances besides Medicare?
We do. The best thing to do is to give us a call, or when a doctor calls us for a referral, we will run that insurance. Most of the time we will have to obtain an authorization, and we can do that, yes.
Wonderful, wonderful. And when you say homebound, you talked about having a taxing effort to get out. Is that someone who is pretty much confined to their home and not able to get out for outpatient physical therapy or occupational therapy?
It's exactly not really meant to be totally homebound. It just means that it's a taxing effort. So a medical condition would warrant a taxing effort. They can actually go to church, or they could get their hair done, They could also pick up some groceries, but they have to have a taxing effort, meaning they might have a shorter breath. The disease is just making an effort to get out and about.
That's great to know. Thank you, Debbie. Thank you so much. Great information. Christina and Abby, what should we know about in-home private care?
So thank you for having us. Basically, in-home private duty care is a little bit different in the sense that it is not based on a skilled need. So we pretty much enable people to be able to age in place in the comfort of their own home after an illness or injury, or for a longer period of time if they really just want to stay in their familiar surroundings with family members, as opposed to moving from their home and into another aging facility. So we are able to provide help with activities of daily living as far as people who need assistance with bathing, dressing, meal preparation, generalized safety. Help with mobility, companionship, transportation to and from appointments. So really the sky's the limit. Our biggest goal is to really enable someone to stay as safe in their home for as long as possible, maximize their independence. We do have a lot of people who have more extensive needs, like significant memory loss or impairment from Alzheimer's disease and dementia. And then there are those folks who just really need some basic support and companionship to maintain their safety in the home.
Wonderful. Wonderful. I do have a question coming through in the chat box. Do you need a physician's order in order to get private home care?
No, we do not. We are a bit different in that regard. And I did want to just turn it over to Abby for a second, who's going to tell you a little bit about the difference between home care and home health, just to make that a little bit more clear.
Thank you so much. That's always a big question that I hear.
So home care, the services we provide are the services that typically insurance companies will not cover. They feel as if their words, not ours, that it's custodial care. So we help with all the activities of daily living, everything from the time you wake up to the time you go to sleep. So we can help with meal prep, light housekeeping. We can help with med reminders. We can help with hygiene. All of those pieces are things that we take care of in the home, compared to the home health piece of it, which is an insurance-based, insurance-paid programming. They come in, as Debbie was saying, and they help with the skilled need. So that's kind of the difference, is that we do not need a physician's order. We can come in and we provide the in-home care to help with those activities of daily living, as Christina mentioned. And as for the payment for us, we are private pay, and we also have long-term care insurance that we will work with the families, help with submitting paperwork, so that long-term care insurance reimbursement can come through and help out with the cost.
That's amazing. That's wonderful. Thank you. Thank you, Abby and Christina. And Holly, will you tell us what we should know about hospice care at home?
Hospice is different in that it is for individuals that are determined to be at the end stage disease process, or an end stage of life. They are determined to be that from the medical director or community physician may send a referral. Their medical condition is obviously has deteriorated, and they are no longer interested in aggressive treatments outside of the home environment. So hospice comes in and we provide that comfort and dignity in their home environment and at the end of life.
Great, great. And is it possible to get therapy while someone is on hospice services?
Yes, therapy is mainly the goal of therapy for our patients, as far as physical therapy or occupational therapy, is for educational purposes for the caregiver, to make sure that the patient is safe in their home environment, and to do some teaching with the caregiver to ensure that the patient, continues to have that safety in the home.
That's wonderful. That's wonderful. So I'd like to try to piece together how all of these entities work together. I get a lot of questions sometimes about people think that we do the same things, or which we do complement each other, but there's so many different things and different avenues that we do. So I'd love to try to piece together how all of these agencies work. So let's say we were to have a gentleman who was at the hospital. Let's call him Mr. Smith. After a stay at the hospital, Mr. Smith gets admitted to Peninsula Home Care for home health services. Maybe he has a congestive heart failure diagnosis. Debbie, what kind of services would Mr. Smith expect to receive from Peninsula Home Care?
We would start out with an RN nurse. She would call the patient and schedule a time to come out to visit the patient. And we would start probably with some discharge instructions, go over meds, go over his disease process, do some education, take care of the vital signs related to CHF, and then offer other disciplines to come in to help him with the CHF, like physical therapy, occupational therapy, and a home health aide may be able to provide the care that he may need. However, I'd like to point out that we are short-term and we are intermittent. So an average time of staying in the home would be an hour, hour and a half with the different disciplines, and maybe 2-3 times per week.
Wonderful, wonderful. So you would offer physical therapy, occupational therapy. Is there speech therapy?
Yes, under you said congestive heart failure. So we would probably be more concentrating on physical therapy, nursing, occupational therapy for conservation of energy. But yes, if there is a speech need, we could provide that.
Wonderful, wonderful. So let's say that while the home health care providers were out, they noticed that it was becoming a little bit more taxing for the families to provide care for Mr. Smith, and that he needed just a little extra care than what is, of course, falls under home health services. What in that case would you all recommend?
We would recommend Bright Star to come in, because a lot of times what we do is we're doing a lot of education. So we have to have support in the home. And if that is not there, Bright Star could come in and help with that while we're educating, while we're doing the physical therapy, while we're doing the occupational therapy.
Great, that's terrific. So Christina, once Bright Star, or once Peninsula Home Care contacts Bright Star, what then would be the process? What happens from there?
So we would actually spend a good bit of time, typically either myself or Abby, getting to know Mr. Smith's needs a little bit more, having an extensive conversation with his family regarding what types of day or what times of day they feel that he could benefit the most from supplemental services. For some people, overnights might be a little bit harder, and families have a fear of someone perhaps trying to get out of bed to use the restroom and falling. Maybe daytimes when families are at work, they may need a little bit of extra help to make sure that their loved one gets breakfast and lunch and maybe dressed and ready for the day. So we would learn all of that from having that conversation with his family, and really kind of finding out more about him, what they're looking for. And from there, we would schedule an in-home consultation with our registered nurse case manager and one of our office managers, who would really sort of go over the nuts and bolts of our services with them. Establish our nursing assessment, and from there, a pretty comprehensive and individualized plan of care for him, so that our care staff knows exactly what we're doing from the time we come into the home, what the family's expectations are, what his needs are. And I always like to sort of say, we can be a standalone service. However, many of our clients are in this situation where they are receiving home health, they are receiving hospice, and we're in a position where we can refer to those entities as well if we see that there is a need, and vice versa.
That's great. That's wonderful. So let's say Mr. Smith starts to not be able to get around as well as he used to. He's had to start using oxygen. He's declining overall. Abby, what would you expect to happen at that point with Bright Star? What would you recommend?
So just to reiterate what Christina said, the next process would be for us to outreach to hospice. to kind of talk to the family and have hospice get involved to continue the next step of his level of care.
Great. Great. And Holly, once Mr. Smith begins hospice, what services will we expect for him to receive?
So once Mr. Smith has elected to be under hospice care, he will receive a nurse visit, a routine nurse that would come out to the home weekly and then as needed. Also a home health aide to help with personal care, which really helps the caregiver. Our spiritual counselor, again, they come to the home, and we have our social worker that helps with those other resources. But the goal is for the patient to be able to be at home, and we come to him or her and help the family and the patient.
That's wonderful. So what about when someone, Christina, if they also still need to have Bright Star at the same time as hospice care, is that okay? Is that possible?
Absolutely. So one of the great things about home care, it's very flexible. And I always like to tell families there is no cookie cutter experience with Bright Star. We have some people that need us for 2 hours a day, all the way to people who really need that 24/7 care. And the same thing with the home health versus home care experience. It's the same with hospice. We're really designed to sort of supplement and complement that service. Hospice is obviously taking the lead as the provider for that patient. And we're just sort of working alongside them in the times when they're not there, just as we would with home health. So one of the important things that I like people to remember is, with us, you can sort of always adapt your schedule. So certainly if we bring someone on who needs less of us in the very beginning, and let's say they do gravitate to a more hospice situation, you can always change your schedule. The goal of home care is to really sort of have it be fluid so that it can change and grow just as that patient's needs are changing and growing over time. It's truly the whole concept of aging in place. So most people start out with just a little bit of assistance, and then we're with them for the duration until, end of life when they need more care. That happens all the time.
That's wonderful. And Holly, when someone is at the end of life and they need increased care, what does it look like with Coastal Hospice? I know the services that are coming out, but how does that look at the end of life as far as care in the home?
Our nurses are educators, and they teach the caregiver to provide that care to the patient as far as medication management, bed-bound care of the patient, incontinence care. We're not 24/7, so we're not in the home the entire time, but we do empower those caregivers to provide that end-of-life care, which is very rewarding for the caregiver.
And what if someone were to need something in the middle of the night? Is there services provided?
Yes, well, we have 24/7 nursing availability. So if a caregiver needs a nurse just to speak to on the phone, we have a triage nurse line. And then they also have the option to have our nurses come out at any time, weekends or nights during the day, if there's been a change of condition or if they just want to have a nurse to assess the patient. So
that's great.
Mm-hmm.
And Dr. Sharon Clark, I do have a question from the audience. Dr. Sharon Clark asked, what are the costs? So maybe we could, I'm not sure if that was referring to which side, so maybe we could take a quick look while we have a few minutes at the cost or insurance base of each thing. Mm-hmm. Debbie, let's start with you. So we said we took Medicare, Medicaid, and private insurances. Is that correct?
Correct. So we're based on payer source. So our services are billed through the patient's insurance. And that would be dependent on what type of insurance the patient has.
Great, great. And how about Abby and Christina from Bright Star?
All of our services are really provided at an hourly rate. It really depends on which area you're receiving the services in. There typically is a range. I will say, however, we pride ourselves in the fact that our rate is very transparent. We do not charge anymore for evenings versus weekends versus days. Your rate is going to be a flat hourly rate, regardless of whether you use us 4 hours a day or 24 hours a day. We do offer some shorter shifts, like 2-hour shifts, which are a little bit different. But for us, it is just that flat hourly rate so that the families can really determine what they need, what they can afford, and further customize a plan specifically for them.
Terrific. Excellent. And Holly, what about hospice services? How is that paid for?
Hospice is actually a Medicare benefit and actually a benefit through other commercial insurances. So it is paid for primarily by Medicare and other insurances. So it's something that we sort of pay into when we have Medicare and insurances. Some people don't know that, but it's definitely a benefit that we like to see our patients take full advantage of before, you know, it's too late. So we like to have those referrals a little earlier than very close to end of life.
Absolutely. Absolutely. Yeah. And what if someone doesn't have insurance and they need hospice services?
It is something that we still have available for those under a charity care type of situation. So it's still something we would offer.
Wonderful. Wonderful. Great. Thank you all so much. It's been very informative. I really appreciate getting to hear all the different sides and how everyone kind of works together and is collaborative. And it just sounds like everyone is really focused on the patient and what the patient might need at that time and what's the best for them. Thank you all so much.
Thank you very much.
Thank you for the invitation.
Absolutely. Absolutely. Thank you again to Debbie Stevens, Christina Wingate Spence, Abby Husfelt, and Holly Murray for helping us navigate through the different kinds of care that we may need at home. And thank you to everyone who has joined us today. We hope the information was useful to you. To wrap things up, we ask you to take a couple of minutes to fill out this short survey. It's only 5 simple questions. Your feedback will help us bring relevant programs to you, your practice, and those you care for. When you click leave the meeting, you will receive a survey from Zoom. This was a presentation from the Coastal Caregiver Academy, supporting and empowering caregivers throughout the community. At Coastal Hospice, we are here for you, and you can call us at any time at the number on the screen. Thank you again for joining us. I'm Lauren Blair. Have a wonderful rest of your day.
Thank you.